There is definite advantage when your electronic medical record company is your billing partner and they know what are the new changes and the new diagnosis. They are up to par with the new CPD codes. The virtual assistant has taken that workload off the office staff. Amazed to see how smooth operations are at my office where they're not waiting for hours and hours. Now the patient is promptly seen and that this practice is much more efficient than other practices. And
I'm thrilled to introduce Dr. Amar Goyal, the owner of Ohio Pain Center. Dr. Goyal has been a valued partner of WRS Health for 13 years, leveraging our billing services to optimize reimbursement processes. Since 2018, Dr. Goyal has also utilized virtual assistant services to support essential administrative tasks such as handling pre-authorizations and managing new patient registrations. We're excited to learn more about your journey and the impact WRS Health has had in your practice. Once again, thank you so much for joining us. Now, Dr. Goyal, before partnering with our billing services, your practice faced challenges in identifying which diagnosis codes were covered and reimbursable for new procedures and services. Now, could you share more about the specific challenges your practice faced before partnering with billing services, particularly in identifying which diagnosis codes were covered and reimbursable for new procedures and services?
there is definite advantage when your electronic medical record company or electronic health record company is your billing partner. So the first challenge I had was the system I had where somebody from the billing company will pick up the paperwork from the office at the end of the day and then they will take it to their office and then they would perform the billing. That was not a very efficient system, and there is time lag and there is loss of paper or misplacement of records, possible HIPAA violation. So all those nuances are eliminated when the electronic medical record company can see your records without going anywhere. So that's a huge advantage right then and there. So I have this billing company currently, which is the part of my electronic health record company or waiting room solutions. So that's an advantage right from the word go. So they are able to access the medical records and they are able to correlate my medical records with the diagnosis. Now, coming to the specific diagnosis and CPD codes, so there was a transition at some point between ICD-9 and ICD-10, and that was made very, very easy by the waiting room solutions billing company and the electronic medical record, especially like the diagnosis for lumbar radiculopathy, lumbar degenerative disc disease, or because my practice is pain management, all the diagnoses were mostly musculoskeletal, pain related. So the treatment revolves around it. The procedure, the CPD code will revolve around that. So like lumbar epidural steroid injection is 62323, which by the way was not the original code. That has over the years changed. So the waiting room solutions billing company helped me with that transition so the ICD 10 codes and the CPD codes are somehow coordinated by AMA, American Medical Association, and Medicare, CGS. And my current billing company is up to date with that. And they know what are the new changes and the new diagnoses, and they apply not only the new diagnosis, but they are up to par with the new CPD codes. For example, lumbar epidural steroid injection 62323 is a new code. It was not the same. So they were promptly up to it and they updated the records and they created a super bill for me, which had that with the updated diagnosis. So that was really helpful.
Great. Thank you so much for sharing that, Dr. Gaya. I believe it's very important for us to have a streamlined process and a good functioning EHR. So that way it's going to be easier for our billers to really create claims and collect reimbursements. By the way, Doctor, how did WRS Health Billing Services address these issues and help improve your reimbursement success?
It's something where you should try to be accurate in your documentation and filing your claim. where I see that if the initial claim is not successfully or not correctly filed, then it somehow enters into a vicious circles of denial or rejections, and then there is a long process where you have to resubmit the claims and resubmit everything, which obviously delays payment. So the WRS billing company, because they have accurate, up-to-date information on the diagnosis code and the procedure code, and they match the correct diagnosis code with the correct procedure code, that makes the first pass, I call it the first pass, claim submission successful. And I think that is a key, and that means uh, quicker reimbursement. And it is all electronic, so apparently if the things are done correctly the very first time, they go seamlessly.
Right, that's fantastic to hear, Dr. Goyal. With our support, your team has been able to submit more accurate claims using the correct diagnosis codes. This has resulted in fewer denials and significantly improved reimbursement for your new services. Now, let's talk about virtual assistant services. Before utilizing our virtual assistant services, your practice faced challenges with handling phone calls efficiently. More recently, managing pre authorizations and new patient registration become a concern. Now, what challenges did your practice face with managing phone calls, pre authorizations, and new patient registrations before partnering with our virtual assistant services?
We had a busy practice, and we have had days which are extremely busy. And if the office staff is busy taking care of the patients, then the phone calls were never answered promptly, which led to some patient dissatisfaction, frustration, sometimes anger, because with my pain management practice, I do have opioid prescriptions, and a lot of patients had questions about their medication where they needed to do a prior authorization, and or they wanted to know the status of the prior authorization. And if the office staff was busy taking care of the patients, that their questions would not be answered promptly, and that the patients were not happy about that. So with the VA service, they have been promptly taking care of the phone and answering the question. And if they are unable to answer the question, then they'll send me an email through the waiting room solution internal portal, and I can see that anytime and answer that, and then they can call the patient back with the required answer. The prior authorization process also can be a challenging in situations where the insurance company is not answering the phone, or they are keeping the phone line occupied for whatever reason, or there are multiple steps. Then the office staff can take care of the patient. If they are involved in prior authorization, then they cannot take care of the patient. So the virtual assistant has taken that workload off the office staff.
Great. Thank you for sharing that, Doctor. I understand that with all of these challenges, our VA services has been able to help your staff in making sure that they prioritize patient care and patient assistance rather than doing these administrative tasks. Doctor, I would like to ask, since we've been doing this for your practice, how has this impacted your practice improvement?
The office runs more smoothly. Some of these patients have gone to other pain clinics before, and they are amazed to see how smooth operations are at my office, where they're not waiting for hours and hours. I have been told at one pain practice they were waiting 4 hours to see the doctor. So now the patient is promptly seen, and chronic pain patients usually don't have a lot of patience anyways, because they are suffering, and sometimes waiting in the waiting room can be a tedious task. So they like the fact that they are promptly seen and evaluated, and then they can go back to their daily life routines, and not just waiting in a chair in the doctor's office, which is a waste of time as well. They notice that the office runs efficiently and smoothly, and their care is taken care of, their procedures are authorized in time, they are getting their procedures, and they're getting their treatment, and there's a clear communication between the office staff in timely fashion. And that is all going to impact, because the patients will then talk to their colleagues or their friends or their family or their co-workers, and they'll tell that this practice is much more efficient than other practices, and that means a great more credibility in the society, and more reputation for my practice, which eventually may mean more business, more remuneration.
I agree to that. Well, thank you so much. That's really incredible, doctor. By taking on essential administrative tasks such as handling pre authorizations and registering new patient referrals, our virtual assistant services have freed up your team to focus on providing quality care and addressing other priorities in your practice. Right. So, Dr. Goyal, thank you so much for sharing your experience with us. Your results, such as a significant decrease in rejection rates and streamlined processes with our virtual assistant services, are truly inspiring. We deeply value your partnership, Doctor, and we are grateful for the opportunity to support the incredible work you do at Ohio Pain Center.